Hello and welcome to the Wachusett Area Chamber of Commerce Business Showcase. I'm Jen Stanovich and I'll be your host as we learn more about the businesses located in the Wachusett area. Today, we're focusing on feet. The average moderately active American takes 5,000 to 7,000 steps a day, often without a thought, until foot pain or other issues demand attention. Fortunately, Associated Foot Specialists in Holden is here to help. Joining us today is the founder and podiatrist, Dr. Anthony Tickner. Hi, Dr. Tickner.
How are you?
I'm good. How are you?
Good. Thanks for inviting me.
Glad to have you here. Let's go back to the beginning. How did you choose to go into this field?
Sure. A great field it is. Family members. So my grandmother was seeing a podiatrist and was so pleased that she said, "You really have to check into this profession." And I said, "I definitely will." And the rest is history.
It was as simple as that.
It was simple.
Well,
It
she
was
must
simple.
have been thrilled.
Absolutely.
And now, years later, you have two practices, right? One in Hudson.
One in Hudson and one in Holden, right here locally. And we've been open since 2007 in Hudson and the past 3 or 4 years here in Holden.
And in Holden, I have to say, all you have to say to someone is we're across from the Pink Building, right?
Absolutely. Our landmarks across from the Pink Building or right next to Papa Gino's.
That's right.
Yeah.
So very conveniently located.
Absolutely.
So how about let's talk about some of the services that you offer.
Yeah, so we see infants, children, young adults, athletes, older people coming through the door. We see everybody.
And what would be the most common foot issues that you see?
So we see a couple. We see curled toes. They're called hammer toes, which can be painful. We see bunions, which is the bump on the inside of the foot that often rubs against the shoe. We see thickened nails with fungus in them. So those are concerns that are the most common.
And all of these are treatable.
All of these are treatable, and we try to stay aggressive with everything we do to get people back on their feet as soon as possible.
Well, I mean, people must come in for just simple foot pain, and they don't know where it comes from.
Right, right. And a lot of the times it's either their shoes or their sneakers or, lack of an insert or padding inside the shoe or the sneaker. So sometimes it's an easy fix. Sometimes we have to look into it a little bit more.
So what would be the process for a patient coming in to see you? Is there an initial exam for everybody or?
Yeah, so it's a simple process. We try to make it easier the better. You can go on our website, which is www.masspodiatrist.com, and all of our forms that you have to fill out, ahead of time are there on the website. If you can't get to the website, we have them in the office, and it's just a matter of calling in the office, setting up an appointment, and then we get you in the sooner the better, and then we can evaluate everything.
So that evaluation, you have x-ray equipment there, I assume?
Absolutely. We have x-ray, we have different types of modalities to check blood supply. We can check the sensation in the feet or the lack thereof. We have all different types of things to give a full assessment.
Well, let's talk about some specific conditions and what you would do to treat them.
Absolutely. So if a patient comes in and says, "I've got numbness in my feet, I can't feel anything," the first thing we think of is it diabetic related? Is it what's called diabetic neuropathy, which over time you can lose a sensation in your feet, and that's due to poor sugar control or just sometimes it's hereditary, sometimes it runs in the family. So that's one of the things we look at. We look at bunions, and a lot of times we can help that with different shoes or sneakers, orthotics. If it's really bad, the last resort is the most aggressive, which is surgical correction of the bunion, which straightens it out and takes the bump away. We also look at the hammer toes, where we can accommodate those and make those feel better. We can also put padding in the inside the shoe and on the toes, removable type things. But again, it's all due to biomechanics, which is how we're walking, how many steps we're taking, how our feet are hitting the ground. So we try to look at all of that.
So do you get into what their lifestyle is and how much walking they do? And
Yeah,
yeah.
yeah, good question because you need exercise, you need to move, and when you don't, we notice that a lot of the patients will say, I put on more weight, or I feel more sluggish, or I can't walk as far,
Mm-hmm.
and that's when we encourage them to walk a little bit more, get some exercise, and that helps tremendously. Diet is also a good place to start. So we want to make sure that they're eating healthier.
Mm-hmm.
I mean, there's so many good foods out there. Sometimes it's hard,
Right.
but we want to make sure they're eating a little bit better. So
So you look at the whole picture, really. It's not just the feet that you're focusing on.
absolutely,
Yeah.
absolutely. It's like pieces to the puzzle.
Sure. Well, you mentioned children. So what what are you looking at when children come in? What do you see?
We see a lot of flat feet.
Mm-hmm.
We see a lot of what's called pronation, where the feet will actually try to turn in when they're walking, and it's almost like the child or the young child looks like they're knock-kneed.
Mm-hmm.
So we try to control that type of motion. A lot of times you can do that with orthotics. There's also landmarks in little children where at different ages their feet will change. The position, the way they hit the ground, all of that will change so we can predict if we need to intervene or if it's just one of their landmarks, which will
Right.
change over time.
Right. Well, and then it's probably good to have a baseline so then they come back and you can see and follow
Absolutely.
them,
Absolutely.
see how they're doing.
Yeah.
Well, I know that you are a very skilled physician and you have some specialties. Wound care is one of them. Talk to me about that.
Sure. I'm the medical director over at the St. Vincent Hospital Wound Care Center. I've been there since 2013. We see all different types of wounds, arterial wounds, diabetic, neuropathic wounds, which are you can't feel where they are. Um, we also see venous type of wounds on the legs, and different types of sores, if you will,
Okay.
that are large, they're smaller, and we can use skin grafts, we can use skin substitutes, we can use the patient's own blood to try to heal those.
Mm-hmm.
So different modalities, different ways to treat these patients.
Well, that's way beyond feet at that
Oh,
point,
absolutely,
right?
absolutely.
Yeah. And you do surgeries too at the hospital, right?
Yes, yes. So anything foot related or you know ankle related,
Mm-hmm.
we see a lot of that. We do bunions primarily, hammer toes. We do plantar fascial type releases where we go in with a little camera and we can snip some of the plantar fascia to take the heel pain away.
Mm-hmm.
So those are probably the biggest ones.
Plantar fasciitis, that's painful, isn't it?
Absolutely.
And it's nice to know that that's treatable, right?
Yeah, completely curable a
Wow,
lot of the times.
that's good.
We use injections, we use orthotics, we use stretching. We have different types of splints that will stretch the area and take the tension off of that area. So a lot of conservative methods, some more aggressive, some more invasive, but yeah, totally treatable and curable.
And your other specialty is in the area of sports?
Absolutely. All different types of athletes, every size, shape. We see football players, soccer players, runners. We're in New England, it's the winter, so we're seeing skiers, snowboarders, different types of athletes of that nature.
Injuries,
Injuries.
different injuries.
Injuries, yes.
Yeah. Well, I would think for your patients who get to know you and you're treating them, and then if they need surgery, it must be nice to know that then you're the one who may be doing the surgery, right?
Right, right. So we have one other doctor in our practice, and that doctor is located in Hudson. I'm primarily in Holden. So if somebody comes to the Holden office and we need to do surgery, more than likely they're going to get me.
Right.
And if they're out in Marlboro or Hudson and they go to our other office, they'll get our associate. So very well trained, very nice staff in both offices.
Yeah.
So we're very lucky.
Yeah. So with all these things going on, now how do you keep up to date with the latest technology in medicine?
Yeah,
It must change all the
it's a
time.
lot of reading. It's a lot of going to conferences and doing continuing education credits and conferring with my colleagues and just keeping up to date. And I don't think there's any dumb questions or any issues where you feel like you don't know it. You just talk to your colleagues, and the hospital runs a residency program, so I bounce a lot of stuff off of them and vice versa. So it's education.
Education. Well, I feel we're fortunate to have you here in Holden, which makes everything so convenient. So thank you for that.
My
And
pleasure.
let's just talk, just as we wrap up, how people get in touch with you again.
Absolutely. The quickest way is through our website, and that is www.masspodiatrists.com.
Okay. And your phone number?
That's 508-829-6645.
Because they can just call and make an appointment too, right?
Absolutely.
Yeah.
Absolutely.
Either way, you'll take them.
That's it.
Yeah. Well, thank you. I appreciate it.
My pleasure.
That wraps up this edition of the Wachusett Area Chamber of Commerce Business Showcase. I would like to thank Dr. Anthony Tickner of Associated Foot Specialists here in Holden. Join us next time as we continue to highlight businesses in the Wachusett area. I'm Jen Stanovich. Thank you for joining us.